That was a great segue to one of our first community questions. So Michael Friebe, one of our longtime community members, has asked the following, and Eric will start this one with you. How do you see the innovation steps towards democratization of health in the metaverse?
Hmm. Well, look, there's a number of different kinds of health, right? It's a large subject. So there's the notion of treating people and delivering medical treatment. There's the notion of mental health treatment. There's the notion of research and drug discovery and things such as collaborative efforts towards improving healthcare. There's also the notion of administering healthcare. How do you actually interact with your healthcare providers and create those environments? So as you break down each of those segments, each one is going to be affected dramatically, though differently, including all the way to the insurance side of things and who's insuring you and how is that done? How are the transactions, as Ishmael said? What we need to talk about is when Salim talked about the notion of transactions, that goes very much to the idea of security and ownership of data. So let's start there with healthcare. The first thing we should note is that as we move into Web3, there's going to become a more prevalent notion of what's known as self-sovereign identity. This is the idea that your health records, your information that matters to you, anything related to your personal data will be owned by you. Well, that wasn't a concept that was really possible, because where would you keep that, right? As long as you keep it somewhere else that somebody else is running, you can't be owned. This notion of decentralization and a blockchain allows you to conceptualize a future where your data is owned by nobody, stored and distributed widely, but owned only by you, with your keys being the access point for not only seeing the data, but distributing it to who gets it and how. So that's the first thing that's going to matter to healthcare a lot. And also to better healthcare, because you can now collaborate among people without having to repeat that information or lose it as you give permissions. The next part of it, which moves away from the maybe transactional part and the security part, but into the social part, is that as you start to add the next layer, the first layer is this notion of identity, right? Of knowing who you are, and the wallet. The next piece is the social aspect. So being able to spontaneously and otherwise interact with people in environments that create a different type of memory, a different type of experience, that's going to be absolutely vital for creating relationships between healthcare providers and patients across space and time. So for group therapy, for AA meetings, for anything where you want to come together and feel that notion of community and to heal together or to be led by somebody where relationships matter, that's also going to dramatically change in this model. And then the last piece, of course, is the NFTs, the things. So we're talking about, when we move to this model of Web3, we're talking about overlaying people, places, and things on the internet as we know it today. So the things is this notion of true ownership. And that's where you have your wallet, you have the spaces and the opportunity to interact with people differently. And then the things are the NFTs, the true ownership, starting with the idea of the data itself, but moving into the idea of objects that are dynamic, network aware, and secure. So imagine a prescription bottle, for instance, that is an NFT, that knows its contraindications and understands when it needs to be refilled, and it has a HIPAA compliant chat between you and the doctor built right into it. And rather than just get the physical item, you're going to get the magical digital twin as well, which is going to come alive within your healthcare system and not only provide these various aspects, but also tap into your social network so that you can actually get a social pressure to follow through on those indications or those health pathways. So we know that all of these pieces are now in place, and we're starting to see for the first time them coming to reality. So the notion of democratization takes each of these pieces and now makes it available to anyone who can get a wallet, even if you don't have a bank account. Now you're going to have access to all of these services and capabilities in a secure way.